So if you found me, you found somebody who has been a nurse for 25 years, and I love talking about things dealing with the heart. I am currently a cardiac nurse. I'm a cardiac triage nurse, and I deal with people every day that have issues with the heart and don't quite understand how to, have a good plan to take care of their heart health every day. So I was talking to somebody not too long ago. They called me because they were having palpitations and they were getting very fatigued. Palpitations and fatigue. That palpitations is when your heart is racing, or it feels like your heart is racing. Sometimes it can feel like your heart is pounding and you feel fatigued. And the reason why you feel fatigued is because your heart is pumping faster than the blood can be carried to the body. So like the blood is going around, but it's not getting the oxygen that it needs. It's not getting the nutrient that it needs to get it to your other organs, to lungs, everywhere it needs to go. It's not doing its job properly. Your heart rate has to be between 60 to 100 beats per minute. That is a normal heart rate that will allow your blood to oxygenate your body. Okay. So this guy, again, palpitations and fatigue. And so I ask him questions because that's what I do. Do you drink caffeine? Oh, yeah. Yeah, I drink a pot of coffee a day. I said, you drink a pot of coffee a day? Is that caffeinated coffee? Because caffeine speeds you up. It's going to speed up your heart rate and speed you up to the point where if you're already having pounding heart or palpitations, you certainly, and you add caffeine to the mix, you're going to have a faster heart rate. So he said he drinks a pot of coffee a day throughout the day. Starts off with 2 cups in the morning. And I'm like, already we're at a deficit. He used to drink 2-liter bottles of soda, which is also caffeinated, but he stopped that. And then I asked him about his water intake, because if you're drinking that much coffee, how much water are you drinking? Not very much water. And so he might also be dehydrated because coffee doesn't hydrate your body. Only water hydrates your body. Okay. And so without him drinking a lot of water, drinking a lot of caffeine, and one other thing that he said he did that I thought was kind of odd is that he loved peanut butter with sugar in it. And he had to have it every day. I thought to myself, peanut butter with sugar. Peanut butter is a protein, but when you add sugar in the mix, sugar in the and he eats it every day. And so I'm looking at the inflammation, because sugar can cause inflammation in your body. I'm looking at the lack of good nutrient for the heart, inflammation of the heart. And I'm not saying that his heart is inflamed. I'm saying that he's a lot of sugar in your body. Your body has to also pump the sugar around. And if you have sugar in your blood, that's more work. So I say all that to say, and then the fact that he's dealing with the heat, okay? We're in the summer months and dehydration is a real issue. And you don't have to be outside to be dehydrated. You could be in your home sitting down, and it's so hot outside, it's affecting what's happening on the inside of your home. Especially if you're not, if your AC is not working, if your AC is not pumping, high, if your temperature is 75, you might be sweating and you might be losing fluid. So if you're sweating and losing fluid, you're getting dehydrated. If check your urine. If your urine is dark colored, yellow and dark colored, if it's not light, if it's not, light yellow, pale, then you might be dehydrated. If you're not going to the bathroom enough, you want to, as much water as you're putting into your body, you want to also urinate out. If you're putting in a gallon of water and you're not urinating but once a day, that's not enough. There's so much that you have to consider, and so much to consider for your health. Okay. I just want to give you some information. If you're having palpitations, if you're drinking a lot of caffeine, you can't have the caffeine with palpitations. And if you're doing that, don't call me and say, hey, I don't feel good, because I'm going to tell you, stop the caffeine, increase the water, stop the sugar intake, lower the sugar intake, sit down, rest your body, and hydrate yourself and see if it makes a difference. I'm also going to tell you, if you're on medication like metoprolol or beta blockers or antiarrhythmics, are you taking your medicine? Are you taking it on time? Are you taking it as prescribed? Because maybe you need to take your medicine. I had somebody else call me. I'm having palpitations. I haven't been having palpitations for a while, but they constantly keep adjusting their own medication. It's not the doctor adjusting the medication. They adjust their own medication. It's hard for a doctor to keep up with your medication and your doses when you're constantly saying to yourself, I got the right answer, I have the right dosage, and yet you're calling me because you're having palpitations. If you're having palpitations and you're not taking your medicine as prescribed, first thing I'm going to recommend is take your medicine as prescribed. These things are not hard, but they're important, and you got to do them. If you're not taking your medication as prescribed, start taking it as prescribed. Then, if you're still having palpitations, we can talk. If you're drinking a lot of caffeine, if you're not drinking water, drink more water, drink less caffeine. And the palpitations still persist after that, then we can talk. But if you're not going to do your part, I don't know how you expect the doctor to do their part when you won't do your part. Okay? It's time to do your part. If you take care of your heart, it's going to take care of you. All right? Bye.